Hello everyone, Dr. Christine Smith back for a really cool session today with Dr. Vincent Pedre, who is an MD that specializes in gut health. He is commonly known as America's Gut Health Doctor, and he's written a couple books. One of the recent ones is the Gut Smart Protocol, and we know each other through mutual professional collaborations, and every time I talk to him, I just really enjoy talking to him, and I think it'll just be a great conversation because he has so much experience in this realm, and I really enjoy talking to people that have an understanding that our health has so much more to do than one organ system at a time. So he talks a lot about how the gut is related to the brain and just a whole bunch of other wonderful topics to understand of how you can start to notice when your system is a little bit dysregulated. So I'm going to go ahead and invite him on here, and hopefully he should be able to join us any second. But he's also just a really interesting person and runs his own clinic out of New York called Pedre Integrative Health. And he did that because in his history, he just couldn't find any clinics that were able to match him in the way that he wanted and were able to provide care in the way that he wanted, because he also went and got a certification as a yoga teacher, and he also has studied medical acupuncture, so he has an understanding of both Eastern and Western medicine. So I'm just going to see if I can get him on there. Ultimately, having a team of practitioners that understand approaching healthcare this way and understand the impact of toxins and how gut health plays into all of the other organ systems in your body is just really important. So hello, Dr. Pedre. Thanks so much for taking the time to do this. So good to see you.
Hey, good to see you. I'm kind of like informal. I just got back from the gym.
Hey, that's okay. You're living the talk, so that's how it's done. I like it.
I'm living
Thank you.
the talk.
Exactly. No, I was just telling everybody kind of a little bit about your history and how you're actually a clinical instructor, and you've also studied yoga and acupuncture and have this holistic understanding of the body, and was talking about your book. So why don't you introduce yourself a little bit and just,
Right here.
Yeah, that's exactly what I just held up. It's been great. I've been reading it. Your recipes in there are money, by the way, so great recipes.
Thank you.
But yeah, why don't you tell us a little bit about how you got into this niche and fell in love with it?
There's so many ways to weave this story in. And one of the stories that I tell is how I almost didn't become a doctor. And that probably is the primary inflection point that determined the type of doctor that I became, and the fact that I found my way to functional medicine in my career. And it started with my fear of needles. And I honestly thought that I was all gung-ho, I'm going to become a doctor. I just thought like being a doctor is so great. And then there was the elephant in the room. Like, I'm afraid of needles. Like, how am I ever going to deal with this? So I'd taken the MCATs, and I came home after taking the medical school entrance exam, and I told my parents, forget it. I don't want to be a doctor anymore. I wasn't really telling them that the reason was that I had this big fear of needles. I passed out every time I got a shot. If I got my blood drawn, I felt queasy, I felt dizzy, my heart would race, I would break out into a cold sweat. And I thought, well, how can I become a doctor if I pass out every time I'm in a room with needles and alcohol makes me feel nauseous? Like the smell of alcohol would just make me kind of like gag. And so they're like, you're becoming a doctor and there's no other choice here. Kind of, sort of. I got to thank my parents for kind of giving me that nudge. That then on my own accord, I was about 21 years old, and decided to start searching for why this happens to me. And my search led me to discovering the autonomic nervous system. And I was asking, like, why is my nervous system betraying me? There wasn't a lot of talk about vagus nerve. It was more parasympathetic and sympathetic. And And I kind of understood that. I understood that sympathetic fight or flight because that was a lot of what I experienced internally, whether it was before an exam and my stomach would get queasy and I'd need to run to the bathroom, or I was about to go on stage and I used to perform the piano and I would feel the butterflies in my stomach, and I had to time my eating just right so that I wouldn't feel nauseous or feel like I need to vomit right before I went on stage. And so I discovered a book called The Relaxation Response by Herbert Benson. And I followed it to the T. I started doing breath work. I started doing meditation. I started doing guided meditation with, if you can go back in time, these were CDs, and I had my Walkman with the headsets, and I would lock myself in my room and do these guided meditations. I would do breath work. And for me, it was like, okay, this is do or die. If I can't figure this out, I can't become a doctor. And I want to become a doctor and help people. So it was, I felt like I was training for the Olympics. Like, and my competition was going to be getting my first Hep B shot and not passing out. And I had 8 months to prepare. So for 8 months, I started breath work. I started doing meditation. And then that really soon into that, I discovered yoga. Like within a month, I started doing yoga as well. So it became breathwork, meditation, yoga, lots of, like self-care stuff. And the test was going to be when I went and got my first shot to see if I could actually, am I going to make it? Am I going to be okay? And the tools that I developed during that time allowed me to get my first Hep B vaccine series shot and not pass out. And when you have a win like that, no medication, basically just using the incredible machine that our body is, the incredible computer that can be reprogrammed, except the programming happens through the breath, through mindset, through visualization, through all those things. I was using a lot of guided imagery, so I would use, that was what really worked for me at the time. And that's changed over the years. So that set in motion, basically a rewiring of my brain that went on throughout my 20s as I got further and further into doctoring. And it really helped me on the path, but also kind of guided the type of doctor that I wanted to be, because during that time I discovered Dr. Mark Hyman, I discovered Andrew Weil, I discovered Deepak Chopra, and I just became a student, and I would devour all of these books, quantum healing, spontaneous healing, all of Dr. Hyman's books. And I knew that was the type of doctor I wanted to be, even though I was in a traditional MD program, that I just figured, well, this is the best path for me, because it's the traditional path. It's what's accepted. So let me go through the traditional path, but then veer off the way I want to go with the credibility that's provided by the MD behind my name. And really, it wasn't until after I finished my residency training that I was still dealing with a lot of gut issues. And I had discovered functional medicine at the time, and I was kind of thinking about, well, what do I want to do next and what speaks to me? And really systems biology was speaking to me, and the interconnectedness of everything in our bodies. And I had just finished studying medical acupuncture, and that opened my eyes to looking at the body as not unrelated systems, but how everything is interconnected. Because you might be able to relate to this, but when you train in internal medicine, the heart patient becomes just the heart, the pneumonia patient is just the lungs, the liver failure is just the liver. And then you have all these consultants, and they're all talking, but they're only talking in their little zone. One's coming in and giving the best recommendations for the heart, but not paying attention to, well, what's going on over here and what's going on over there, and how about the person? How are they doing? there's no holistic point of view. And so when I trained in acupuncture and started looking at the body as a system of interactions, I actually started changing the way I thought about the body. And before that, I had done my yoga teacher training, and the yoga brought me from being an intellectual that thought about the internal processes of the body to bringing me outside, looking at the person, looking at the structure, looking how they're sitting, looking at how they're breathing, and how that affects all of their other things that they're experiencing. Maybe they're not taking deep enough breaths. I can't tell you. I mean, I know you connect with me on this because of the gut brain and vagus nerve. I think a lot of problems that people face could be solved by just teaching them how to breathe properly.
Oh yeah. I'll say, like, I mean, I have a bunch of patients who do what's called paradoxical breathing, and it's where you're kind of breathing up here instead of using your diaphragm. And then they'll say that they can't get a deep breath, and it's just about understanding it, which then activates your vagus nerve and regulates different parts of your nervous system. So everything that you're talking about, I couldn't agree more.
Yeah.
Beautiful. Thank you so much for sharing that. I really like doing these because I actually get to meet my colleagues in a different way, and I get to hear stories that I don't always hear. And it's really fun to get to see the depth of somebody and understand, what doctors go through in the process of becoming. Like, it is a never ending process, and we're constantly learning. And it's just, school is basically just this like jumping off point, and everything else is everything after that. So
it's just the foundation.
Oh, yeah.
And if you get stuck on that foundation and you don't continue to kind of evolve with the trends and understanding the complexities of the human body and our psyche, I think you fall behind.
Absolutely. And for those asking, the name of the book was The Relaxation Response. Or if you're asking about the other book, this is Dr. Pedre's book, The Gut Smart Protocol.
By the way, I have in this new book, I've got a whole section on, I call turbocharging your results. And it's really about gut brain, balancing the vagus nerve, a bunch of breathwork exercises, as well as meditations and mindfulness practices for the gut that are meant to improve digestion. But hey, when you improve your digestion, you actually improve everything else. And if people go to gutsmartprotocol.com, they can actually go into resources and find all of these. The meditations and breathwork in my book are recorded by the teacher themselves, because I interviewed all these really cool people, some really great meditation people you might know, like Emily Fletcher, and they're on the website.
Excellent. I love that you just provide those resources, because this is why
for free.
These, right?
Anybody can use them. Like they're there for anybody to use.
We just want you guys to have this information and know where to find it, because the biggest question I get all the time is, how do I find the right functional medicine doctor? And so I love doing this and bringing people like yourself on, because then people can find you, especially in New York, which is like a tricky place to find a functional medicine doctor sometimes. So with that, I think that's a perfect way to just kind of jump into like the next question I had for you. And let's kind of stay in the nervous system and gut relationship realm, because I know that's the project that you're diving into next, and we can kind of talk about that too. But in your book, you kind of cover like the 7 categories of leaky gut symptom. So I can list them, and then I'll let you just kind of dive into them. But essentially, for a list so that you guys will go over it multiple times, skin can be related to your gut, airway, your brain, your joints, your energy, your metabolism, and your immune system. So let's dive into all those and why your gut is so connected with the rest of your body, and why it's one of the first touch points you should be considering when you're working on your health.
First of all, the gut is the entry point for all nutrients. It's the command central for your immune system, and it's basically the control center for inflammation in the body. Now, inflammation can happen anywhere in the body, obviously, but think of the gut as sort of like the thermostat, and it can either turn the heat up or it can turn the heat down. And it all depends on a number of things: the types of foods you're eating, the type of damage that's been done to the gut lining, what's happening to your gut microbiome, because that little community that lives inside of us, inside each and every one of us, is really important. It's important what they're doing. It's important what they're metabolizing. It's important what they are producing as postbiotic nutrients. All of that is regulating how the rest of our bodies are doing. So, I think like even we could say gut muscle connection, like building muscle is super important. Like that's what I was doing before at the gym, is building, working on staying lean and building muscle mass. But I couldn't do this if I'm not making enough stomach acid and my proteases aren't activated so that I break down the protein properly. And if I have leaky gut, then I'm not absorbing proteins while I'm not breaking down proteins into amino acids that are the building blocks for muscle. So even for something like muscle tissue, before that comes good digestion. If you can't digest, if you can't break down your proteins, then you're not going to build muscle tissue in your body. But same goes for everything else, because we need those amino acids to be the building blocks for every enzyme, because each enzyme in the body is a protein, and it has to be created in every single cell. So every cell in your body needs protein in order to survive and to fulfill its daily processes. So, but you can't get the right amount of protein if when you eat, your digestive system isn't able to break that protein down into absorbable amino acids.
Yep. And, I just saw another question come up around like things like DAO, which for those who don't know, it's an enzyme that helps to break down histamine. And as your gut gets disrupted and your microbiome gets disrupted, your ability to break down irritants like histamine can also be disrupted. And
Absolutely.
then your immune system gets overactivated, which uses up those minimal sources of protein you have if you're not able to break them down well. And this is how people get stuck in this like weird chronic inflammation cycle.
Yeah.
And it's like, if you can't absorb the nutrients, you can't heal. And then that can affect a whole bunch of things. And I like how you say in your book, like, your gut is basically your inside skin. So outside skin, inside skin, same skin.
I
Something's
love
going on with
that.
your
Yeah,
skin.
I was writing a blog post about it, and I just thought, hey, your gut is actually your inner skin. It's basically, and actually in many ways, I mean, you think about like embryologic development, the gut develops by the embryo folding in on itself. So it's actually the outer skin becomes that inner lining of the gut, and actually then becomes the airway as well. So the airway and the gut develop in a very similar way to each other, which is really fascinating because in Chinese medicine, the airway and the digestive system are interrelated. And when you're treating things in the airway, you're actually using acupuncture points that relate to the digestive system as well. So they knew for thousands of years that there was an interconnection before we could look at a microscope and see how embryo development happens. But yeah, I mean, that's why what we see on the surface of our skin is actually a reflection of what's happening inside our bodies. And again, leaky gut being the common underlying root cause that leads to these 7 interconnected issues. So a lot of times people get confused, like, well, how do I have a gut issue if I have a skin issue? Or like, how is dementia connected to gut health? Or well, if I can't lose weight, how is that connected to my gut health? All of these things through leaky gut, because leaky gut, if you can imagine, is like opening the floodgates of inflammation. So it's not controlling the influx of things into the body, like endotoxin from bacteria in the gut that are highly inflammatory. They turn on the alarm system in the body. And when your body is in an alarm state, it can't do things like shed weight. It causes mitochondrial dysfunction. So energy drops, you feel fatigued. And not all fatigue is thyroid. That's really important to remember. And you might be a thyroid patient and your thyroid numbers, maybe you're on thyroid replacement and your numbers look perfect, and yet you feel horrible. Well, because it's not just a thyroid issue, it's a mitochondrial issue, and you have to look at the interconnection, what's happening with the gut, and has there been antibiotic exposure because mitochondria are extremely sensitive to antibiotics, and a lot of antibiotics can cause some pretty severe mitochondrial dysfunction, like the fluoroquinolones. And that's why when you take an antibiotic, some people complain like, "Oh, I'm feeling exhausted, like I feel wiped out," and they think, well, that's a part of the normal process. Sometimes it can be die-off and whatnot, but it can also be that it's actually causing mitochondrial dysfunction.
I'm so glad that you just brought that up. I think this is perfect. So that list that I said, the skin, airway, brain, joints, energy, metabolism, immune, we were pretty much just talking about this. And a lot of people forget how much of your immune system lives in your gut. And most people have heard of that. A lot of people forget how much of your immune system also lives in your lungs. There's a lot of mast cell reactions in the lungs, which is why toxin exposure of a whole bunch of different kinds can cause a variety of different issues, or, mast cell activation syndrome, things like that. And there's so many documented studies about disrupted microbiome and asthma. So like that's well documented in the literature. And I think that's perfect and kind of goes into our next question, because everything that we're talking about, the immune system kind of plays a role in the things like the brain and the joints, and then the metabolism and energy is kind of the mitochondria.
And I would even group there something that I didn't quite put into the book, but joints with bones. So together, because they're finding that the gut microbiome also can influence and regulate the speed of calcium absorption, and then can have a direct effect on bone rebuilding, bone remodeling versus bone loss in menopause, after menopause, or in andropause.
That would mean that people with osteoporosis should probably check out their gut. Just putting it out there for anyone struggling with that. Beautiful. Yeah. So let's dive into that antibiotic comment, because I think that's something that people forget about, that like, yes, antibiotics can be life-saving and they absolutely have a role. However, it's basically like dropping a nuclear bomb in your body. It's an injury that you have to recover from. And I'd love to hear your thoughts on that.
I want to start by saying, like, antibiotics can be life-saving, right? So I've had many patients that I've actually kept out of the hospital by putting them on antibiotics. So not only can antibiotics be life-saving, but they can also reduce the cost of healthcare, because the minute that you avoid a hospitalization, you've actually prevented the exponential exploding cost of healthcare in this country. Now, that said, I think where we get it wrong is that the majority of doctors who are prescribing antibiotics don't realize that there is a consequence that needs to be dealt with after you put somebody on antibiotics. And so the antibiotic prescription doesn't end after you fix the infection. It ends when you repopulate and heal the gut from the effects of antibiotics, because antibiotics cause, one, they kill good and bad bugs, so they're going to cause dysbiosis, an imbalance of good and bad bugs. A lot of times they can lead to yeast overgrowth. That yeast overgrowth can lead to the overproduction of mycotoxins, which are damaging to the gut lining and the brain. So then you have leaky gut as well. And then you get all the other issues and symptoms that happen with leaky gut. And sometimes you get a breakdown of the immune system, and the person who got sick then gets sick again 2 to 3 months later. And so a lot of times over the years, what I've seen is people go to an ENT and they get antibiotics for a sinus infection, fixes the sinus infection, but nothing is done to rebuild the gut, improve the gut border, repopulate, help re-nourish the gut so that the good bacteria, the probiotic bacteria, can thrive again. And 2 to 3 months later, they go back to their ENT with sinus congestion, get a second round of antibiotics. That gets better. And then 2 or 3 months later, they go back. And I'm mentioning this because these are the patients that I've seen, 3 rounds of antibiotics in 6 months for sinus infection. Then find me, come work with me, because now they have yeast overgrowth. Their gut is a mess. And they're questioning now their ENT, like, I don't want to go on another round of it, but they're saying I need to go on a 4th round of antibiotics to fix everything. And it's like, you're just keeping the person in this horrible loop without rebuilding the foundation that is so key and important, because if you don't, then it results in all sorts of issues down the pipeline. And that's what happened to me. I had been on 20 plus rounds of antibiotics from the age of around 10 to the age of 19. So 2 to 3 rounds per year as a child, going to pediatricians, and they would just happily write prescription for antibiotics, one after another after another. Oh, you have sinusitis, or you have bronchitis, or you have pharyngitis. Here's an antibiotic script. So as a child, I had been trained to think you get sick, you go and get an antibiotic script. That's the pathway. There's no other way to heal. You get sick, you get antibiotics, then you feel better. And then you're programmed as a person. And it's hard. In my early years of doing functional medicine, I had patients that would get upset with me when I would tell them that they have a viral infection. It does not require antibiotics. We're going to support their immune system. They need to take dairy out of the diet, and they're going to get better. Granted, sometimes you have those kind of those iffy cases, you know, the gray zones, where it could be viral, it could be bacterial. So you're always kind of like using clinical judgment. Sometimes what I like to do is do swab testing, and I do specialized swab testing to look for methicillin-resistant Staph aureus, for example, or other nasty bugs that might be in there. So sometimes if people go to their ENT and they do a swab, but they send it to the regular lab, they might not find the things that I find when I send it to the specialty lab that knows how to look for these things and also checks for biofilm in the sinuses to see if we have a chronic infection that needs to be broken down. And a lot of times we can do it with local sprays and sometimes colloidal silver. So sometimes not having to go for systemic antibiotics. And at the same time, doing what needs to be done to make sure the gut lining is protected and make sure the gut lining is restored. So the doctor of the future would be prescribing antibiotics and at the same time thinking about probiotics and ways to protect the gut and to reestablish the diversity in the gut to help the person recover from the antibiotic course. And honestly, it depends on a lot of factors, because again, you don't want to not give antibiotics to somebody who clearly needs them. You know, sometimes you need that rescue, and then you work on lifestyle and you work on sugar intake and dairy and wheat and all the things that might be inhibiting their immune response. But in the acute setting, you've got to do the thing that's going to help fix the matter, while then start working on the things, the lifestyle changes, the things that are going to improve their immune response, because the immune system is very integrally, as you said, 80% of our immune system is all along the gut lining. It is command central for our immune system. And if it's command central, I got to say that if there is a control center, we imagine who's sitting up in that control center. Well, our gut bugs are up on that bridge, pulling a lot of the levers in that control center. They are controlling the immune response. And we know that good gut bugs like lactobacilli can actually help T cells mature into T regulatory cells that then go and do what their name implies. They regulate the immune response. So making sure that your immune system doesn't attack too much or doesn't do too little.
So even for people dealing with autoimmune, these considerations in your gut are probably one of the most important things to check out, because exactly like you said, it regulates your entire immune function. And our gut is essentially where our immune system goes to get trained. If you have an inflamed gut all the time, our immune system is going to get trained to react in a hyper-inflammatory way. And I think, like, as we're talking about this and you're talking about antibiotics, even without antibiotics, we can get leaky gut just from all of the like toxins in our environment.
Stress,
mental
toxins,
stress.
over-the-counter medications like NSAIDs increase gut permeability. Also, you know, we think that, you know, quote unquote, acetaminophen is safe for the gut. In a sense, it can cause liver damage when taken in too high doses. But I did find a study that showed that acetaminophen led to dysbiosis. And once you have dysbiosis, that can cause leaky gut. So there might be another pathway, maybe a little bit indirect, for acetaminophen to cause leaky gut, and the birth control pill as well increases gut permeability. So all these women who are on birth control, which I understand why, like you don't want an unwanted pregnancy. I completely understand. But think about all the women that are on birth control who then start gaining weight as soon as they go on birth
Or their
control.
mood
And
shifts, and then they get put on an antidepressant, which
yeah,
further messes up your gut.
and then they can't lose the weight, but they're taking the birth control. Well, it's causing leaky gut. That leaky gut is increasing inflammatory signals inside the body. And when your body is inflamed, it's going to increase insulin resistance. It's going to cause more fat deposition in the middle. So it makes it almost impossible. Like you can't fight the internal system until you remove the thing that's actually blocking the healing process.
Could not agree more. And I know you're also working on like a new project that has to do more with like the nervous system and gut connection and the connection from the gut to the brain. And like a lot of people don't know that you can get what's called like retrograde transport up the vagus nerve. So meaning like molecules can travel backwards from your gut up your vagus nerve to your brain. And it's now being theorized that that plays a lot of roles in things like Parkinson's and neurodegeneration. So I'd love to talk a little bit about the brain, gut, nervous system relationship and just what you have been finding the most interesting as you're working on your new project.
Yeah, this is kind of a spinoff, one from what I think people are asking for, and two from that section in my new book that's all about optimizing the gut-brain connection. So I'm working on a digital course called Gut-Brain Mastery, and it's to help people go from chaos to calm using the power of the gut-brain connection to basically slay their stress, sharpen their focus, and unlock the intuitive potential within, because our gut is the second brain, and that's where our intuition lives. I actually like to joke that our gut, when it comes to intuition, it's actually our first brain, and this is the second brain. This one will lead you wrong, this one will always lead you right. And the idea behind this is to not only help people develop preventive practices that are going to improve gut-brain communication, people who might fear dementia, they have dementia in their family, Alzheimer's, but also everybody who's stressed out.
Like
everybody? Who's stressed out? Like, give me a thumbs up in the comments. Like, who is listening and you are stressed out? I know I am. And I know that we all have to deal with a high level of stress. Now, what if I told you that that stress is partly, your stress response is partly being controlled by your gut microbiome? And what was really interesting, I gave a lecture on this back in the fall of last year, where I was talking about the gut-brain connection and stress. And I found a really interesting study. Now, it was a study done in germ-free mice, but we use germ-free mice as a model for what happens when you put certain bacteria in the gut and what happens if they're not present. And these were newly born germ-free mice, and they were putting them through a stressor that would activate the HPA amygdala, like the stress response. And what they found was that the germ-free mice had a higher stress response. Now, when they took those mice and they gave them bifidobacterium, that bifido reprogrammed the amygdala and it lowered their stress response. So we know that there's something happening in the gut that is actually controlling what's happening inside the pons, the midbrain, the more reptilian, the part of the brain that really just reacts but doesn't know how to process so well. And so I want to help people be able to basically tap into that power within themselves to lower the way that their body reacts to stress, because we can't get rid of the stress. The stress is always going to be there. It's always going to come. There's always going to be surprises. The thing that I learned from when I was meditating before I went to medical school is that the way we respond to stress has nothing to do with the stress outside of us. It has everything to do with our own internal environment. That's where our stress response comes from. It's our reaction to the outside world that creates that stress. Now, part of that you're thinking is, well, that's mental, that's mindset, like that's all controlled up here. But we're finding that actually the gut microbiome plays a significant role in that gut-brain axis. And as you mentioned, the vagus nerve, which works in two directions, and it's just, I mean, it's a can of worms, but I love talking about this stuff and that's why I decided that instead of doing a course about my book per se, that I wanted to kind of zero in and help the people who are stressed, who are lacking focus, who maybe are so disconnected from themselves that they've lost their own gut feelings, their intuition, and do this through a program that teaches you how to access that in many different ways, through diet, through mindset, through breath work, through meditation, bringing it all together.
I love that. And, you know, it's interesting because you're talking about how the difference in the gut microbes can affect your stress response. But then there's also a ton of research going the other direction of how when you meditate, you actually alter your gut biome.
It's almost like it's this incredible, almost like irony or contradiction. It's kind of like the chicken or the egg. And it's like, well, do you go one way or do you go the other? And I think you go both ways.
Both is ideal. Yeah, that's what
I think you go both ways. You have to hack the system by hacking your brain. And we do that through meditation practices, through mindfulness, even just doing things that you don't have to meditate in order to be in a meditative state. You know, so for example, if your thing is going out and mountain biking, I bet when you're really focused on mountain biking and you're super present, you're in a meditative state. Or if your thing is weaving, when you spend some time weaving and you're just doing the repetitive motion and you're focused on that one activity, that also puts your brain into a meditative state. Or if you play an instrument. So there's many avenues, as I learned over my many years of meditating, that there's many avenues to basically hack the system and create that sense of calm inside, that sense of safety that is needed. But I think a lot of people just don't know how to access that.
I think that's incredibly true. And I want to give people a chance to like know where to go, and I want to honor your time and everything, but I'd love if we could kind of end with a little bit of like a deeper thought, because you and I have had some great conversations, and I know that you have done some really like deep personal introspective bigger thinking about life. And you know, one of the ways that we know each other is there is this sunrise hike that a group of us went on at a conference that we were at, and it was a way to get in that flow state. And like, we weren't closed eyes and meditating, we were outside, but we were just really present in what we were doing. And so things like that can transform your internal world. But if we were going to leave people with kind of like one of your favorite personal realizations that you've had in your own journey of holistic health, and just something that you'd want everybody to know, like what would you tell them? And then if they wanted to learn more about you and your programs, where would you tell them to go?
Okay. Yeah. So basically you broke up a little bit, but you were saying one of my own personal realizations on.
Yeah, just like one of those deeper personal introspective things. Like, for example, one of the things that, you know, I've learned is that healing has a lot less to do with figuring out what's wrong with you and a lot more to do with focusing on everything that's right with you and remembering what it feels like to enjoy your life or be excited about your future, or not always be worrying about your health, and practicing existing in that state.
Yeah, I love that, like glass half full versus glass half empty, which is so important for people who are dealing with chronic health issues where the issue is always in their face. So they're constantly just thinking about the glass half empty side of the equation. And almost it's almost like people can't see compliments. They fail to see the good things because all they do is focus on the bad stuff. And I'm not saying as a judgment, because I've been guilty of that. I think we're all guilty of having those moments when we're letting the things that have gone wrong actually control the way we're experiencing our day. And and so, okay, so realization, I want to say this actually in relation to that, that I started practicing, I go in and out of certain practices, but one thing is, it's having a morning routine. And,
Mm.
and, and I'm going to get to the thing, but one of the things that I started doing in the morning routine that I found to be really powerful is starting with a gratitude, then writing what is it that I want to call in
Mm.
that day, just on the day. I'm not like, not my whole life, like just for today. What is it that I want to call in? Do I want to call in more love? Do I want to call in more presence? Do I want to make sure that I smile when I go get a coffee or whatever it is? And then the next thing I write is, how is it going to feel when that thing that I'm calling in happens? How is it going to feel? And then the last piece is, what aligned action do I need to take in order to make this happen today? What am I going to do? You know, do I want more focus? Do I want more presence? Do I want more love? Then what is it concretely that you're going to do? And this is just a side note, because really what comes up for me when you were asking me, like, what is kind of a big, almost like a big aha on something that can really move the needle. And I got to take a breath for this one. And I think you'll understand why when I say it. It's forgiveness. And it's not just forgiving others, it's forgiving ourselves for the judgments that we place upon ourselves. This is the practice that I've been working on with a coach this year. And there's nothing that more powerfully can get me from being fine to like basically like a mess with tears coming down my eyes than doing a forgiveness practice where you out loud you say something like, I forgive myself for judging myself for not being good enough. I forgive myself for judging myself that I wasn't good enough, so I didn't pursue this thing because I thought I was not good enough
And I
for
think
it.
there's a very important piece in there that you said, where it's not like, I forgive myself for not being good enough. It's, I forgive myself for judging myself for not being good enough. Because,
You're
yeah,
forgiving the judgment that is above the the actual thing that was judged.
yep. And they've shown
Giving
in,
judgment. And it can be for so many things, like I forgive myself for thinking that I'm responsible for my autoimmune disease, you know, and this I'm just saying as an example. I forgive myself for all the anger that I have inside, you know, and when you really do this work with people, like I've done it with patients, I mean, you get to a place inside that is so fragile and so innocent at the same time, and it holds the power to heal your entire being, mind, body, spirit. It holds all of that power, because a lot of times the need for forgiveness is tied to an event in the past that happened at a different age. And when you're doing that, you're basically creating this quantum relativity healing through time that is healing the entire timeline of the things that happened that then caused your illness to begin, or whatever it is that you're dealing with. And you feel this weight come off your shoulders.
I could not agree more. And, there's a lot of interesting research out there showing that forgiveness is one of the emotions that can most easily induce an alpha brainwave state, which is essentially a meditative state. So then with like that line of thinking, I would say it would be safe to say that forgiveness probably also affects your gut biome, and therefore your immune system, and therefore your inflammation, and therefore everything else that we were talking about.
Everything. Yeah.
Amazing. Thank you for sharing that, Pearl. That I love ending with those deeper thoughts. If people were interested in learning more about you or your books or your program, where would you tell them to go?
They can go to gutsmartprotocol.com. Here's the book, gutsmartprotocol.com. And I'm on Instagram, so my profile is up right now as I'm talking to you at Dr. Pedre, DRPEDRE. And as you know, I'm quite active on here, as are you. And so I try to post a lot of educational and entertaining content. So edutainment, try to educate and entertain at the same time, and provide a lot of free resources and value to people. But honestly, like even something like this is less than $25 to get basically a huge download of my wisdom on basically a template, a personalized gut healing program based on a quiz.
And a lot of people, or a lot of clients I get, they'll say like, everyone tells me what to do, but I don't really know how, and I don't know how to cook, and I don't know how to do, like, there's a whole bunch of recipes. It's the entire back of the book, and they're awesome. I was looking through them. I'm planning to make some this week.
And if you can't cook, I tell you exactly what foods you can eat and what you can't eat, or what you should avoid if you want to heal your gut, to heal your body. So then it makes it really easy when you're going out to eat to figure out, okay, I can have this, but not this. I know it requires a bit of analysis, and it does sometimes make you that person, that's at the dinner table saying, well, is this made with canola oil, or is this olive oil, or can you make this dish?
That doesn't get to mention.
By the way, that is a pearl for anybody who eats out, which is most of us. If you're not asking what oils they're using, very likely they're using canola oil, soybean oil, peanut oil to make the foods that are coming out, because they're cheaper oils. And something I learned from my friends, because I have a friend who actually will break out in an allergic reaction with things like canola or soybean oil, you can ask them to make the dish with olive oil. You can get them to switch and make it. They just don't want to do that for everybody because olive oil is more expensive. But the truth is that it's so much better to avoid these inflammatory oils when you can. And if you don't ask, that's the one thing, like you might go out to a restaurant and you're like, oh, I can't eat gluten, I can't eat this. But no one thinks to ask, well, what oil are you using to cook this with? Yep. And those inflammatory oils are an insult to the gut and an insult to the body as well. So, hey, just a little pearl there.
No, I mean, like all these little tips, we can only control so much in our environment, and our world is just getting more and more toxic. So the one thing we can control is what we put in our mouth. And if you have like an uncomfortable feeling about asking for something that you need, that could be something else to explore. Like, why am I uncomfortable asking for what I need when I value myself and my body? Exactly. And that might just be one of those
exactly.
things.
And look, I've been there where you don't want to be the standout, or you're in with your friends and you don't want to be that one who makes a big deal about something. And finally, I just got to the point where I'm like, I almost want to curse. I'm like, F it. Who cares? My health is more important than what other people's opinions of me are going to be. And if they're my friends, whatever I do, because they know that I take care of myself, and I live the example that I want to be for that I want my patients to be, right? Or I want anybody who follows me to be. I don't want to be preaching one thing and then behind doing a different thing. I do the same stuff. Whatever I preach, I'm doing myself.
Hey, it's like walking onto a live after being at the gym, right? Just walking the talk. And for anyone who just asked, yes, his book is totally readable and more in terms that the general public can easily understand. So it is for everybody.
Yeah.
Perfect. Thank you so much for taking time out of your day to do this and for just sharing your wisdom and educating people, because I think that is the future of medicine, right? Is educating people so they can be their own health authority the majority of the time. So thank you. And yeah, make sure to check out his book, check out the website. He'll have cool new projects coming out, which I'm sure he'll also advertise on his Instagram. So feel free to follow all the things. And any last thoughts?
No, I mean, people can find me through my Instagram. My other website is happygutlife.com, and I'm going to be unrolling the digital course through the Happy Gut brand, and also an upcoming membership where people can be mentored by me in a group setting about gut health issues.
Fantastic. And for anyone in New York, he's in New York, and it's really handy to have a great functional medicine doctor in New York. So make sure to check him out. Thank you so much. I could talk to you for days, but I will let you go. I'm sure you're busy. So have a wonderful rest of your day, and I'll look forward to talking to you soon.
Talk to you soon. Nice to
You
see
too.
you. Bye.